Anatomy of duodenum in very short. Anatomy of duodenum. So duodenum is approximately 30 centimeter and 12 finger breadths in length. So it is called duodenum, that is 12 finger breadths, and it has 4 parts. So we have duodenum. How much is the length? Approximately 30 centimeter, and duodenum has 4 parts. So we have D1, which is intraperitoneal short superior duodenum. D1 is intraperitoneal short superior. Intraperitoneal short superior starts beyond the pyloric muscle ring and of the stomach and goes to where it crosses over the common bile duct and gastroduodenal artery in the hepatoduodenal ligament. Then we have D2, and D2 is retroperitoneal descending duodenum. Retroperitoneal descending duodenum extends from the hepatoduodenal ligament to the ampulla of Vater. Okay, so next we have is D3. So D3, and what is D3? Is retroperitoneal transverse duodenum. Retroperitoneal transverse duodenum. Retroperitoneal transverse duodenum. Next we have is D4, and retroperitoneal transverse duodenum. D3 is from the ampulla of Vater to the superior mesenteric vein and artery at the encinate process of the pancreas. Finally, we have the retroperitoneal and distal intraperitoneal ascending duodenum, D4. So what is D4? D4 is retroperitoneal and distal intraperitoneal ascending. Retroperitoneal and distal intraperitoneal ascending duodenum, and distal intraperitoneal ascending duodenum. So we have these 4 parts: D1, D2, D3 and D4. Now let us see the extent of these parts. So D1 extends from pyloric muscle ring. D1 extends from pyloric muscle ring of the stomach to hepatoduodenal ligament. This is the extent of D1. Then extent of D2. D2 extends from hepatoduodenal ligament to ampulla of Vater. Ampulla of Vater. So this is D2. D2 is the retroperitoneal descending duodenum, extends from hepatoduodenal ligament to the ampulla of Vater. Then we have D3. D3 extends from ampulla of Vater to superior mesenteric vein and artery. at the uncinate process of pancreas. Extends from ampulla of Vater or Vater, whatever, to superior mesenteric vein and artery at uncinate process of pancreas. Superior mesenteric vein and superior mesenteric artery at uncinate process of pancreas. Uncinate process of pancreas. This is D3. Then we have D4. And D4 extends from mesenteric vessels to the duodenojejunal junction at ligament of Treves. Mesenteric vessels, that is SMA and SMV, to the duodenojejunal junction at ligament of Treves. Duodenojejunal junction at ligament of Treves. Mesenteric vessels to duodenojejunal junction at ligament of Treves. So the duct of Wirsung or main pancreatic duct enters the common bile duct to form a poorly named ampulla of Vater. This empties into the medial wall of the duodenum at the papilla junction of D2, D3. So the common bile duct and the main pancreatic duct, they join together to form the poorly named ampulla of Vater, which empties into the medial wall of the duodenum at the papilla junction of D2 and D3, which can be palpated through a traumatic perforation or rupture of reasonable size in this area. There is an accessory duct of Santorini, which enters the minor papilla in D2, which lies 2 cm proximal to the major papilla. So we have the ampulla of Vater with the major papilla at the junction of D2 and D3. And duct of Santorini, it opens as a minor papilla, and just 2 cm proximal we have a minor papilla where duct of Santorini opens, and duct of Santorini is the accessory pancreatic duct. So the vascular anatomy of upper abdomen complicates management of duodenal and pancreatic injuries, particularly the shared blood supply of the C loop of the duodenum and head of pancreas. So the superior pancreatico-duodenal artery is a branch of the gastroduodenal artery, is the arterial supply of the upper half of the duodenum. The inferior pancreatico-duodenal artery, a branch of superior mesenteric artery, is the arterial supply of the lower half of the duodenum. So blood supply of duodenum is divided into upper half and lower half. Blood supply of duodenum. So we have an upper half, upper half is supplied by the gastroduodenal artery with the branch superior pancreatico-duodenal artery. Superior pancreato-duodenal artery, and we have a lower half which is supplied by Lower half is supplied by the superior mesenteric artery, which gives the branch called the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. So upper half is supplied by superior pancreatico-duodenal artery, which is a branch of gastroduodenal artery, and lower half is supplied by inferior pancreatico-duodenal artery, which is the branch of superior mesenteric artery. Then we have the veins. So the veins are superior pancreatico-duodenal veins, superior pancreatico-duodenal vein. It has two it drains into two branches. Superior pancreatico-duodenal vein drains into the right gastroepiploic vein, anterior branch, and the posterior branch drains into the portal vein. So we have two branches, anterior branch and posterior branch. Anterior branch and posterior branch. So superior pancreatico-duodenal vein has two branches, anterior and posterior. Anterior branch drains into right gastroepiploic vein, and posterior branch drains into the portal vein. And then we have the inferior pancreatico-duodenal vein. Duodenal vein, which drains into superior mesenteric vein. Superior mesenteric vein. So this is the surgical anatomy of duodenum. Let us revise. Duodenum is approximately 30 cm, that is 12 finger breadths in size. It has 4 parts: D1, D2, D3 and D4. D1 is intraperitoneal short superior and extends from the pyloric muscle ring of stomach to the hepatoduodenal ligament. D2 is retroperitoneal descending and it extends from the hepatoduodenal ligament to the ampulla of Vater. D3 is retroperitoneal transverse. So D3 extends from the ampulla of Vater to the SMV and SMA at the uncinate process of pancreas. And D4 is retroperitoneal and the distal portion is intraperitoneal ascending. So D4 extends from the mesenteric vessels SMA and SMV to the duodenojejunal junction at the ligament of Treves. Ampulla of Vater is at the junction of D2 and D3, and just 2 cm proximal to it is a minor papilla with duct of Santorini, which is the accessory pancreatic duct. Blood supply of duodenum is divided into upper half and lower half. Upper half is supplied by superior pancreatico-duodenal artery, which is a branch of gastroduodenal artery, and lower half is supplied by the inferior pancreatico-duodenal artery, which is a branch of superior mesenteric artery. Superior pancreatico-duodenal vein has two branches, anterior and posterior, which drain into right gastroepiploic vein and portal vein respectively. Inferior pancreatico-duodenal vein drains into superior mesenteric vein. So associated injuries in patients with duodenal trauma are most commonly to an upper abdominal vessel, liver, colon and pancreas, approximately 1/3 of the time. So pancreas will be injured approximately 1/3 of the time in duodenal trauma.